It almost feels like telehealth has gone through the complete Gartner hype cycle in 6 months. So expectations to peak to disillusionment, literally in about 6 months. So people are sitting there going, this is going to be the change. It's the tipping point. We're now at a new norm. It's going to be amazing. To some of the things we're reading now is telehealth visits are way down, and people, I don't think anyone thought we would sustain what we were doing at the peak. The numbers are just staggering, and we're amazing. But it hasn't turned out. Some people feel like it hasn't turned out to be that tipping point, and that they're disillusioned. Was the pandemic a tipping point for telehealth, or was there just an illusion of a tipping point?
I think it depends on how you define the tipping point, right? If the thought is that it's a tipping point in that we're not going to have these challenges with adoption, that the people that have been championing telehealth for years can finally take a breath and relax, and that they've tried it and they love it, they're going to love it, and it's going to continue to accelerate, then no, that's not how medicine and healthcare works. I think if you define the tipping point as we have gotten engagement and understanding on the value and the potential value of telehealth from stakeholders at both the healthcare institution level, at the policymaker level, payer level, from patients and population health experts, and folks genuinely see both the value and the challenges of implementing telehealth and are now aligned towards an approach to really moving towards a digital transformation that integrates telehealth into the provision of care in a meaningful way so that we can support patients with chronic and complex conditions and improve the coordination of care and improve the coordination with the patient-centered medical home, then yeah, I think this could certainly be a tipping point. The key is, do we focus in on those opportunities? I think there's a huge, what the pandemic has done has provided us with an amazing opportunity and an amazing amount of data that we can use to drive this transformation. But it's not just people. I think people that talk about a tipping point, often they were talking about other people's tipping point. They were right all along. And these other people that just weren't getting on board with telehealth, it's a tipping point for them. That's not true. It should be a tipping point for all of us. We have to learn from this experience and look at the low-hanging fruit of telehealth is now not so much the on-demand, urgent care, minor acute condition type approach, as much as it is a really integrated approach to managing these chronic, complex, high-cost conditions and moving towards a value-based approach that can not only improve outcomes and improve quality, but lower costs and really achieve these goals that telehealth has always talked about achieving.